Disrupt Health. I am your host, Julie Palumbo, and we have a great session for you today. I have a wonderful guest, Dr. Nicole Rivera, and she is the owner of the Integrative Wellness Group, and she actually handles all of the complex cases for the Integrative Wellness Group. She is an integrative wellness physician. So we are going to really take a deep dive into something completely different than we have ever done before. And we're going to actually talk about the skin today. And Dr. Nicole, I welcome you here to the show. And I want you to just tell us a little bit more about yourself and the company and the business that you run with your husband, Dr. Nick.
Yes, of course. So like Julie said, we are the owners of Integrative Wellness Group, and our practice has actually evolved quite a bit over time. We really started doing some really basic testing. We were doing more comprehensive blood work than your traditional blood work. And then we were actually doing heavy metal testing. And with that being said, our big focus was lifestyle changes as well as diet and supplements. And what happened over time is that we found some people were getting amazing results with that approach. And then there were some people that hit roadblocks. So because of that, we kept changing and evolving our practice to be more and more comprehensive and also to get more and more specific. We just found that a lot of the people coming through our doors were more complex cases, and we needed to make sure that we could figure out exactly what their body needed and not necessarily what was the cookie cutter protocol for specific diagnoses. So from there, we really advanced a lot of our medical technologies, and we also expanded our staff. And like Julia said, I am the one heading the complex cases, but my husband actually heads all neurological and brain-related conditions. And then we also have Dr. Kyle, who works with pediatrics as well as preparing for pregnancy. So we have quite the group, and we all have different specialties. We're all very well versed in each other's specialties, but we just choose to work with certain populations because of where our passion lies, essentially.
That's awesome. I'm so glad to hear that you are obviously a very comprehensive group and you offer everything from pretty much infancy all the way through adulthood. And actually today is the start of a series that we're going to do together, and we're going to start with infancy and children and how we could start getting our skin or our children's skin in the best shape starting out. And I wanted to just kind of open it up to what are common skin issues that you do find in infants and children?
There's so many different skin manifestations that can happen, but not all of them suit the textbook. And I think that is a really important factor for people to take away, is that your child might have some different types of skin issues or skin eruptions or rashes, but it doesn't always fit the textbook to give you that diagnosis. So regardless if it has a diagnosis or not, it is something that is coming to the surface because it's pretty much saying there's something going on in the internal environment and it needs to be addressed. But one of the most common that we are going to see is going to be infant eczema. Again, infant eczema doesn't always look the same. It's on some children's abdomen, it's on some children's legs, it's on some children's neck. Some children have it everywhere. That is definitely a very, very common manifestation. We are also seeing vitiligo in younger and younger ages. Vitiligo is actually when you're losing the pigment, which you'll often see just pale spots on the body. Sometimes this really looks like nothing. It looks like, oh, maybe it's a birthmark. And then all of a sudden you start to notice more and more pop up. But this is something that I have seen 6 months as an infant, as early as that time period. Wow. So vitiligo is autoimmune. Technically, it is on the rise. But I would say that is something that is happening more often, but we're definitely seeing the eczema. And again, we're seeing these non-traditional manifestations as well. I've seen a child that had head to toe, it almost looked like scabies, but it wasn't scabies. And that had to do with some different things that were going on in the internal environment as well, which we're going to dive into. But overall, again, your child could have everything from a rash that maybe pops up after eating Your child could have hives, your child could have eczema, your child could have pale spots, and your child could also have different pigment changes that are actually darker than the skin, which is a different manifestation, actually more associated with the liver. So it could be all over the map, but the skin is your largest organ, number one. And number two is your skin is reflective of the dysfunction that is happening internally.
Got it. That is so fascinating. And it's actually interesting that you bring that up about the skin being the largest organ, because I think we as a whole often forget that, and we often focus more on what's going inside our bodies versus what's going on our bodies. So we have to always remember that the skin is the largest organ and take care of that as well as what we put inside our bodies. Do you see any types of issues with speaking of what we put on our skin, with what parents put on children as far as lotions and bath products and things like that?
I was just going to say, we need to touch on that piece. So what's so interesting to me is, so first of all, when I was in school, one of my classes that I had to take was a toxicology class. And toxicology class, I was kind of like, oh, this is interesting. Why do we have to take this? And one of the things that we had to do while we were in that course was we all had to choose one personal product that we use very often. And we actually had to do a massive research project on it. So at the end, the last few weeks of the course, everybody was presenting about a personal product. And obviously we all had to choose something different. And we were pretty much providing research on everything from tampons to lotions to shampoos, conditioners, toothpaste, mouthwash. And I literally could not believe the level of toxicity that was in a lot of these products that we use.
Gosh.
And one of the big ones actually had to do with a very common brand that we often buy that supplies a lot of baby-based products. But these products, when you actually get down to the nitty-gritty of the ingredients, you're actually finding that a lot of the ingredients are petroleum-based. Petroleum is a byproduct of gasoline, which is extremely carcinogenic and toxic to the body. So you have to really do your due diligence with looking at what is in the products that are being recommended for your child. Because unfortunately, a lot of these really big name brands, they're very focused on profit. And I get it as a business owner, I get it. But as you become more focused on profit, you will start to change ingredients and you will start to use cheaper ingredients, which then doesn't always mean that they're going to be very safe for the person. So that's kind of the rule of thumb, is the really, really big companies, you have to really start looking at those ingredient labels to be careful. There are some really fantastic companies geared towards children, like something that's readily available in, I think, Target, and even in some of the pharmacies is like the Honest Company.
Yep.
And they're really doing a great job to remove a lot of these chemicals out of the products. But you really want to make sure that you're not putting things on your baby's skin that is potentially creating a toxic load.
That's really important to know, and thank you for sharing all of that, because it starts right out of the gate. And I know that recently I've been cleaning up what I've been putting on my skin for those exact reasons. So that's really important to share. Now, aside from what you put on your skin, and you touched upon this earlier, what are some things that are the big causes for these skin issues for children? Why are they getting all of these conditions such as eczema and everything else? What's going on inside that's causing that?
Well, this was actually an interesting scenario that only happened a few months ago, but we had a infant that came in 3 months old, skin head to toe. This is the child that looks like he literally had scabies. And when his mom brought him in, I was obviously digging into the history, really trying to understand, when did it start? Was there some specific thing that caused this to flare? Was it topical? Was there a lotion? Was there some reaction to the formula, etc.? And it turned out that the child was a C-section, planned C-section, because she was high risk. So when we started to do some of our testing, what we realized was that this child had a very compromised lymphatic system. And I'm going to explain this because I don't expect people to understand what this means. So your lymphatic system is head to toe. And most of us are familiar with our lymph nodes because in our neck, when we get sick and all of this hurts, it's not just because of your glands, it's actually because of the surrounding lymph nodes that are trying to clean up the infection you've been exposed to. So your lymph, again, head to toe, is your major filtration system. But your lymph is also very superficial, so it's very, very close to the skin. So if your lymph is compromised, you will often see skin manifestations. So going back to the C-section, what happens is that your lymph is supposed to move around your body like a river. So very fluid, very beautiful, and it picks up on the bad stuff and it gets rid of it. So if it starts to become overloaded or it starts to become filled with different types of toxins, then what will happen is it starts to become kind of like sludge and it's not moving anymore and you're not detoxing, and then you start to have things coming out of the skin. So to my surprise, as well as even yours, is how does a 3-month-old have a compromised lymphatic system? You know, usually our lymph will become problematic 10, 20, 30, 40, 50 years down the line. And this is what's funny. This is what we call aging. When we all start to feel worse as we age, it's actually because your detox pathways don't work as well as they used to. So we'll touch on that on another video. So what happened for this child is that mom had some different health issues that we talked about. Because obviously she didn't come in for herself, she came in for the child, but we always have to ask mom about certain things. So mom had some very specific types of infections. Mom also grew up in a very polluted area outside of New York City. So that definitely played a role in some toxins that were actually in her system that got into her amniotic fluid. So that's the fluid that the baby is in throughout the entire pregnancy. So there was some toxic transfer. I don't want this to freak people out, but it happens. So there was some toxic transfer. And what happens is as you go through the birth canal, what will normally happen is the birth canal is obviously very small. So it will pretty much get anything out of the lymph nodes, like excess fluid, excess toxins, and it will squeeze the lymphatic system to get rid of any of those things that would have been in there in the first place. So this baby, being a C-section, actually came out of the womb with an already compromised lymphatic system, which then all those toxins that were in the amniotic fluid were now trying to come out through the skin.
Interesting.
So not the most common scenario, but it can happen, and especially with C-sections. This was a very simple fix. It was really about doing some lymphatic therapies with the babies. So we actually did in our office something called craniosacral therapy, which is like a very gentle therapy that actually gets the lymph moving properly. And then we also recommended for her to do infant massage, which sounds so funny, but it's really just gently mobilizing the lymph. And then the lymph was able to eradicate out the things that were gunked up in there.
Wow. So aside from your lymphatic system maybe being compromised, is there anything else that could lead to skin issues?
So the other big one is definitely going to be the liver, and that kind of piggybacks off of what we're talking about. So the liver, again, is a major filtration system of the body. It actually detoxes out anything foreign that we've been exposed to. So for those of you not necessarily familiar with this concept of toxicity, is when I say toxicity, this is everything from the things we're exposed to in our personal products. So some of those chemicals from plastic, chemicals in the world of pesticides and herbicides, which are used regularly in farming. And then we also have a lot of things from dental exposure. So many of us have heard that these silver fillings are not good, and maybe we should consider getting them swapped out for white fillings. So these are all very, very simple examples of toxicity. So if mom has some of these exposures, which we all do, so I don't want you to leave this this video thinking like, oh my gosh, this is scary. And I have to, I have to change everything I'm doing and I have to navigate around this. And how am I going to ever be able to avoid it? You can't avoid the toxins. All you can do is get your detox pathways working better. Okay. So I want to really reiterate that because it's so important to understand don't live in fear, because you can really support your body's ability to get rid of this stuff. Our bodies are designed to get rid of it, and the liver is part of that. So if mom, again, has had some of these toxic burdens in her own system, so the firstborn, which I am, firstborn gets 80% of mom's toxic load.
Wow.
Yes.
Well, fortunately, I'm second born, so if you're second born, hopefully it's a lot less.
So the second born gets majority of mom's infections.
Oh,
yeah. So the first two get all the good stuff.
Nice.
So with the firstborn, if you are getting some level of transfer of toxins, the liver is going to have to work on that. And so the liver being a little bit overloaded is something that can definitely create some of these different skin manifestations. Mm-hmm. What you'll normally see is that the skin on the abdomen will be affected.
Okay.
Yeah. So it would be specifically skin on the abdomen. And you might also see different types of spots, either darker or paler than the regular skin pigment that will be over the right rib cage.
Okay, so that means liver is compromised. And I know, just through my own readings, having Crohn's disease, I know that the gut has a big impact on our entire body, externally and internally. What does that do for the skin? How is that correlated to skin issues?
And the gut, I would say, of everything we've talked about today, the gut probably has the biggest impact on the skin. And that's again because the gut is your second largest organ. So it's literally, most people don't realize your gastrointestinal system technically starts in your mouth. Mm-hmm. So you have so many areas that need to communicate with each other and also need to be properly functioning for the overall health of your entire body. Mm-hmm. So with that being said, when you're dealing with the gut, there is a lot of different things that can happen very, very early on. And one of the things is that we mentioned second born gets a majority of mom's infections. But regardless, a lot of us are walking around with some type of imbalance in our gastrointestinal system. And it's partly because of all of the pesticides and herbicides that we use in our farming industry nowadays. Oh. So that's one part of the puzzle. And then the other part of the puzzle is every time we eat food, there's bacteria on it. That's just real life. That's just the way that it is. Mm-hmm. But some people, depending on your stress level, depending on how burnt out you are, depending on, other factors with your immune system, if you get exposed to a certain type of bacteria from something you ate and your immune system is down, you might get that bacteria into your system and it might just stay. It might just hang out there. Okay. So if some of these things are going on in mom's system, and then that's how the exposure happens to the child, the other way this also happens too is if there are bacteria in the vaginal tract. So obviously as the baby is coming out of the birth canal, they could be exposed to different types of bacteria. The other big one is that a lot of children are being exposed to abnormal flora from hospitals. Okay. So hospitals, think about it. It is a petri dish of many, many types of organisms. And some of them are good that will benefit our immune system and some of them are not good. Right. So we have like 3 different ways that you can get exposed to different types of microbes that will throw off the gastrointestinal system. One of them is transfer from mom, the other one is birth canal, and the other one is the hospital. So all of those different things can play a role gastrointestinally. Mm-hmm. So with that being said, if you are someone who is especially using formula, and first of all, for those of you familiar, if you've ever looked at formula, the first to second ingredient is usually sugar. Yeah. So, and unfortunately, it's usually not good quality sugar. It's usually brown rice syrup or sucrose, things like that.
Mm-hmm.
So if you are having a baby that's dealing with a lot of reflux, or they're getting a massively distended belly after their formula, it's probably because the sugar is feeding the bad bacteria in their gut.
Yep.
So this is something that's really important to be able to decipher, because this isn't necessarily just about skin issues. Yes, your child might have skin issues if their gastrointestinal system is really out of balance, but they might be having the reflux. They might, be having abnormal bowel movements. They might be colic because they're in pain.
Yes.
So these are all really, really important factors to take into consideration with the gastrointestinal system. So yes, the gastro system might be a little bit off, but it can be irritated more depending on the type of formula that you are using.
Interesting. So basically, when we see things on the skin, just to recap what you've been telling us, isn't necessarily an external thing like the lotions or the bath products that you're using. It could be the lymphatic system, the liver, and the gut imbalance that could lead to it. So there could be an underlying issue that maybe is now just presenting itself externally. So that's why like a little rash is maybe something to look into if changing bath products doesn't do the trick.
Yeah. Well, even too, baby acne is one that we kind of missed, but baby acne is something that, it is completely dismissed as perfectly normal. But again, going back to the conversation about the baby coming through the birth canal and potentially being exposed to different types of bacteria, those bacteria can get into the sinuses as well. Mm-hmm. And if you think about the sinuses and the skin, you can easily have different things that are in the sinuses that are pushing out to the skin as well. So that could be, the baby acne that's not necessarily clearing up quite quickly.
Interesting. So as I mentioned, this is going to be a series. So this is part one of our series of essentially health through life, starting with right out of the gate, when we're babies and treating our babies. So with that, and, next time we're going to go into the adolescent area, which we know is the perfect time to have amazing skin. So before we go into those lovely years, Dr. Nicole, what is one thing that you want us to take away from this session? I know that there are a few things that you mentioned that you said, don't be scared. I don't want people to walk away from this thinking, oh my gosh, I'm just completely loading my baby with toxins even before it's born. What is the one thing that you want us to really take away from this so that we could start our child's lives in the best shape possible?
I guess there's a few things. So for women that are not pregnant yet, and they are thinking about getting pregnant, and they are like, I really want to make sure my body is in the best shape possible, is you can easily get some different tests done to really see where your body is at, to make sure that you're not carrying many toxins. And if you are, which again, a lot of us are, it's being able to have very, very strategic tools to get rid of some of that. So just a simple hair analysis will tell you if you have different types of heavy metals. And then we have a lot of really customized testing in our practice that will evaluate those different levels as well, and then be able to get your body set for a super, super healthy pregnancy. Great. For those of you listening that are maybe already pregnant or you're breastfeeding, one of the absolute best, most safe options for cleansing your body, but also if you're breastfeeding, cleansing your breast milk, so you're not transferring any toxins to your baby, is a supplement called chlorella.
Okay.
So chlorella is pretty much chlorella is chlorophyll, so it comes from a plant. You have to be very strategic on where you buy chlorella. I personally love the company called BioPure. It's very, very pure, but go figure, BioPure. But with that being said, is when you're taking chlorella, especially when you're breastfeeding, it has been proven to remove 95% of the toxins out of the breast milk. Wow. So this is extremely effective at making sure that there is nothing being passed, but it's also helping to cleanse your body and keep you super well. And then if you are dealing with a child that has skin issues already, so if you've made some modifications and your child is doing well, that's fantastic. But something you can do on your own, if you are breastfeeding, again, the chlorella, if you're doing formula, turn that bottle around or turn the box around and look at what is in it, because most of the formulas that are in the US are not very good quality. You also might be dealing with a child that has an issue with cow dairy. So one of the alternatives is using goat-based formula. The one company is called Gabrita. So you can definitely try that first. But if your child's skin issues is still persisting, it's a matter of just getting the right testing to really know what is going on, because kids are pretty easy. They're very, very resilient. It's just a matter of knowing, where is it stemming from? Is it from the lymph? Is it from the gut? Is it from the liver? And once you know that, you're able to take those next steps and resolve it as fast as possible.
That's great. Thank you so much for providing the solutions. And you could always check out the Integrative Wellness Group to do further testing and information, and all of your contact information, Dr. Nicole, is presented here for our viewers to see. And I thank you so much for starting off our series on this wellness journey, so that we know exactly what to do to make our bodies and our babies the healthiest that they could be. And as I mentioned before, next week we'll be talking about progression into our lives of adolescence and making sure that our skin and our bodies maintain, or your children's skin and bodies maintain, the highest quality in health and wellness that they could be. Well, thanks, Dr. Nicole. I look forward to seeing you again soon. Everyone, thank you so much for tuning in. Again, I am Julie Palumbo. This is Disrupt Health, and I look forward to seeing you again next time.